So EMDR is eye movement desensitization reprocessing. So it's a long mouthful of words, but it's EMDR. So what happens with EMDR is we're working on the eye movement. So when the eyes move from right to left, our brain's actually filtering out memories we don't need. So our eyes go from right to left naturally when we're asleep, in the REM sleep cycle. So when we're in a deep sleep, our eyes are going from right to left, filtering out what we don't need. We don't need to remember what we had for lunch. We don't need to remember what we talked about at the post office yesterday. We just don't need to remember those things. But what happens when we have trauma is we remember these memories, right? And those memories are associated with uncomfortable feelings in the body, emotions, and dysregulation in the nervous system. And so what happens is when we do EMDR, what we're doing is we're doing the REM sleep cycle on that memory. So we're telling the brain, I don't need this anymore. I don't need this anymore. And so what happens when we do EMDR is it's a peak as well. So what happens is that person's intensity will increase in the body, the emotions, as we do the belief system, the memory, the sensations, and it will peak. And then what happens is it comes down on the other side, and then they start to feel nothing for that memory anymore. So it's like might go from a 9 or a 10 to a 0. And so that's what EMDR does. It's filtering out the memory that we don't need anymore. A lot of clients do say to me it's a very different experience to the experiences they've had with other clinicians. I did my training in Texas in the USA, and I trained with somatic therapists. So I think how I've been trained is, from that somatic perspective as well. So I think that how I'm trained is to, really feel into the body. So there are things that I may do that other clinicians don't do, which is, if someone's starting to feel something in their hands, I might get them to shake their hands and to shake it out. Or if they feel it in their legs, I might get them to move their legs. And so we're shifting that energy through the body. And so I think that's why it's a very different experience. Also, because I am a somatic therapist, I am getting people to really get in touch with their body, their sensations, their emotions, and we're really focusing on that because trauma is trapped in the body. So I think a lot of clients say to me, it is a different experience, but it's a very effective experience. So the EMDR flash technique is really, it's an eye movement as well, but it's a little bit different to EMDR in the way that I do EMDR. So but the flash technique is really about being able to avoid having to sit in the memory. So with EMDR, we have to sit in the memory, we have to hold that memory, we have to run that memory in our mind as we're doing the eye movements. With the flash technique, we don't. With the flash technique, they are able to sit in a positive memory. So it's really great for people who disassociate, people who can't sit in that negative memory, it's just too painful. So, and it's also really great for shame. Now, it's actually the only thing I've found that really helps people overcome their shame. And so the flash technique is an advanced training that I did at the start of this year. And it's really about being able to not have to sit in the memory that's really painful and really difficult. So that might be like, if you've experienced sexual abuse or you've experienced physical abuse, or there's been some other really traumatic thing and it's just too painful. And I totally get that. And so this is a technique that's used that can really help bypass having to sit in that painful memory. So we'll do the flash technique, which is a different set of eye movements, and then we'll come back into EMDR and program in the positive belief system after we've done the negative belief.